Smoking and alcohol destroy millions of lives every single year across the United States, Canada, United Kingdom, and Australia, and the damage often begins long before the addiction becomes obvious. Breaking the grip of nicotine and alcohol isn't just about willpower, it's about what's going on inside the brain, the gut, the nervous system, and your entire biochemistry. Supplements can become a lifeline, not by replacing treatment or therapy, but by giving the brain what it's starved of, reducing cravings, stabilizing mood, and helping the body rebuild what was damaged. Many Americans try quitting over and over, yet fall back into smoking or binge drinking because their brain chemistry is not getting the help it desperately needs. The withdrawal symptoms are overwhelming: anxiety, depression, fatigue, mood swings, cravings, insomnia, and the traditional approach barely addresses these biochemical needs. People blame themselves, but the truth is their brain is begging for support. Nutritional support changes the game. The first supplement that must be discussed is N-acetylcysteine, NAC, which has been shown in multiple clinical studies in the United States and United Kingdom to reduce cravings for both nicotine and alcohol. NAC is a powerful antioxidant that supports glutathione production in the liver and brain, helping detoxify the body from alcohol and cigarette toxins. But what makes NAC so valuable is its effect on the brain's glutamate system. This is the E, part of the brain responsible for impulse control and addiction cycles. When people quit smoking or drinking, their glutamate levels are out of control, leading to stress and anxiety that push them right back to using. NAC normalizes glutamate, making it easier to say no. People report feeling calmer, more focused, and more in control within days of starting NAC. In many rehab centers across Canada and Australia, NAC is becoming a go-to supplement for relapse prevention because of this exact mechanism. Next on the list is L-tyrosine, an amino acid that the brain uses to make dopamine, the neurotransmitter linked to pleasure, motivation, and reward. Smoking and alcohol abuse hijack the dopamine system. When someone quits, dopamine levels crash, leading to a deep sense of emptiness and lack of drive. This is why so many people feel like they've lost their personality or joy when they quit. L-tyrosine helps bring dopamine back online naturally, without creating a new dependency. It provides the raw material the brain needs to begin functioning normally again. In clinical reports from the United States, L-tyrosine supplementation has helped people rebuild their focus, improve their mood, and reduce the cravings that are driven by low dopamine. Without tyrosine, the brain feels like it's stuck in a fog after quitting. This amino acid is like flipping the power switch back on. Magnesium glycinate is another supplement that deserves serious attention. Alcohol depletes magnesium rapidly, and smoking contributes to oxidative stress that increases the body's need for this essential mineral. Most people in the United States are magnesium deficient and don't even know it. This deficiency causes nervousness, restlessness, insomnia, muscle tension, irritability, and headaches, symptoms that are almost identical to withdrawal from both nicotine and alcohol. Magnesium glycinate, known for its high absorption and calming effects, helps stabilize the nervous system. People often describe it as a sense of peace returning to the body. It helps with sleep, lowers cortisol, and reduces those edge-of-your-seat feelings that make relapse more likely. In recovery centers across the United Kingdom, magnesium is considered one of the core foundational nutrients for people in early stages of quitting. Vitamin B complex, especially B6, B9, folate, and B12, are absolutely essential because chronic alcohol use and smoking destroy these vitamins. B vitamins are needed for neurotransmitter synthesis, liver detoxification, energy metabolism, and red blood cell formation. A deficiency can lead to fatigue, depression, brain fog, and irritability. Many patients in recovery from alcohol addiction in Canadian programs show massive improvements in mood and energy once they're started on a high-potency B complex. B6 is needed to produce serotonin and dopamine. B12 helps protect the nerves and reduce fatigue. Folate supports methylation, which impacts emotional stability. The sad truth is that without B vitamins, the brain literally cannot feel good, even if someone stays clean from cigarettes or alcohol. In the United States, many practitioners are now testing people for methylation-related gene mutations, like MTHFR, and are recommending methylated forms of folate and B12 to ensure absorption. Another critical supplement is omega-3 fatty acids, particularly EPA and DHA from fish oil. These fatty acids are major components of the brain and nervous system. Chronic alcohol use reduces brain volume and damages the structure of brain cells. Smoking increases oxidative stress in the brain and contributes to inflammation that leads to depression, anxiety, and memory issues. Omega-3s help rebuild these damaged structures. In studies conducted in the United States and Australia, omega-3 supplementation has been shown to reduce relapse rates, improve cognitive function, and help with mood stabilization in recovering addicts. They're also anti-inflammatory, supporting cardiovascular health, liver function, and even lung recovery, all of which are damaged by substance use. Many people describe clearer thinking, better memory, and a more optimistic outlook within. Weeks of starting high-dose EPA, DHA supplementation, L-glutamine, is another amino acid that deserves deep focus. When people drink or smoke, they are unconsciously seeking to balance brain chemistry and blood sugar levels. L-glutamine helps stabilize blood sugar, reducing cravings for alcohol and cigarettes that are often triggered by drops in glucose. It also helps repair the gut lining, which is often damaged in people with long-term alcohol use. Cravings can be biological and tied to nutrient deficiencies, not just emotional weakness. In programs across the United Kingdom and Australia, glutamine is used to help reduce nighttime cravings and improve gut health. It's one of those supplements that works quietly in the background but delivers massive relief when taken consistently. Milk thistle, silymarin, is another supplement that's incredibly useful, especially for people who've been drinking heavily. For years, alcohol is processed primarily by the liver, and long-term use leads to fatty liver, cirrhosis, and toxic buildup. Smoking also puts pressure on the liver because of the heavy metals and chemical load. Milk thistle helps regenerate liver cells, support detoxification pathways, and reduce inflammation in the liver. In clinical trials across the United States, milk thistle has shown protective effects, even in people with significant liver damage. For people recovering from alcohol abuse, supporting the liver is essential, not just for detox, but for regaining energy, digestion, and hormone balance. GABA, gamma-aminobutyric acid, a natural calming neurotransmitter, is another supplement that many people in recovery find life-saving. Alcohol artificially boosts GABA levels, which is why it feels relaxing, but the brain eventually stops producing its own. When someone quits, they go into a hyper-excited state with anxiety, insomnia, and restlessness. GABA supplements, particularly in the form of pharma-GABA or GABA precursors like theanine, can help restore calm without causing dependence. In several Canadian clinical settings, GABA has been used to help people sleep better, reduce panic attacks, and stay grounded during early recovery. It's not a sedative, but a nutrient that helps the body do what it was supposed to do before substance abuse interfered. Ashwagandha, an adaptogenic herb, is gaining popularity in smoking and alcohol recovery programs in the United States and Australia. It helps balance cortisol, supports adrenal function, and improves resilience to stress. Stress is a major relapse trigger. Ashwagandha reduces anxiety, improves sleep, and enhances focus without stimulating the nervous system. People describe feeling more emotionally steady, more confident, and more able to handle difficult situations without needing a drink or a smoke to calm down. Some studies even suggest that ashwagandha may influence dopamine levels, giving it a dual benefit in addiction recovery. Zinc, often overlooked, is another vital mineral for recovery. Alcohol and tobacco both strip zinc from the body, and this deficiency is linked to poor immune function. low testosterone, depression, and impaired wound healing. Zinc plays a critical role in neurotransmitter production and brain repair. In multiple studies from the United States and the United Kingdom, zinc supplementation has helped improve mood, reduce cravings, and restore normal sleep patterns. The emotional crash that many people feel during detox can be partly caused by zinc deficiency. HTP, 5-hydroxytryptophan, is a direct precursor to serotonin, the neurotransmitter linked to happiness, emotional stability, and appetite regulation. Quitting alcohol or cigarettes causes a rapid drop in serotonin levels. This leads to depression, irritability, anxiety, and even obsessive thinking about drinking or smoking. 5-HTP can help restore serotonin levels naturally. In American trials, 5-HTP was shown to help people reduce alcohol intake and improve sleep and mood. It's not a cure on its own, but for someone stuck in the emotional roller coaster of recovery, it can provide a much-needed emotional anchor. Another game-changing supplement that plays a vital role in smoking and alcohol cessation is rhodiola rosea, an adaptogenic herb that supports the brain and adrenal system under stress. Most people trying to quit cigarettes or alcohol are under extreme emotional pressure, work stress, family stress, emotional trauma, and rhodiola helps buffer the body against these pressures without overstimulating the nervous system. Unlike caffeine or other stimulants, it provides energy without creating jitteriness. It improves mental stamina, reduces fatigue, and lifts the mood. In trials conducted in Canada and the United States, rhodiola supplementation improved the motivation and resilience of individuals in early recovery, helping them maintain sobriety and resist urges to relapse. It especially helps people who feel completely emotionally drained or mentally exhausted, which is a common state during withdrawal. Quitting smoking or drinking often feels like your body has been hit by a freight train, and rhodiola supports physical and emotional recovery. Probiotics are another essential and often overlooked supplement. Years of smoking and drinking destroy gut flora. Alcohol is a known gut irritant and increases intestinal permeability, often referred to as leaky gut. Smoking introduces thousands of toxic chemicals that inflame the digestive tract. When gut flora is imbalanced, it affects everything from immune function to serotonin production, because over 90% of the body's serotonin is produced in the gut. People in recovery frequently struggle with digestive issues, cravings for sugar, and mood instability, all of which can be traced back to the gut. In recovery centers across the United Kingdom, Australia, and the United States, high-potency probiotic formulas are being used not just for digestion, but to help regulate mood, reduce inflammation, and support immune function. People often notice better bowel movements, clearer skin, improved mental clarity, and reduced anxiety when gut flora begins to normalize. DL-phenylalanine, DLPA, is another highly specialized amino acid blend used in addiction support because of its ability to increase dopamine and endorphin levels. Endorphins are the body's natural painkillers and pleasure chemicals. Alcohol and nicotine create artificial spikes in endorphins, which is why users feel relief, calm, or even euphoria. But over time, the body stops producing its own endorphins. When a person quits, they feel emotionally raw, sensitive, even hopeless. DLPA supports the production of natural endorphins and dopamine, helping restore emotional resilience and inner calm. Many people in recovery describe DLPA as a switch that brings color back into their life. They feel enjoyment, motivation, and even humor again after weeks of emotional numbness. In addiction programs in the United States, DLPA has helped reduce both physical pain and emotional cravings by supporting the body's natural reward system. Same S-adenosylmethionine plays a vital role in methylation, which affects neurotransmitter balance, detoxification, and liver support. In people recovering from alcohol use disorder, SAME has been studied for its ability to reduce symptoms of depression and improve liver health. It works by enhancing the production of serotonin, dopamine, and norepinephrine, critical brain, chemicals that become imbalanced during addiction. People with genetic methylation issues, which are common in the United States and Canada, may struggle even more with mood issues during withdrawal, and SAMe can provide a powerful correction without the need for pharmaceuticals. In studies, SAMe has worked as well as prescription antidepressants for people with alcohol-related depression, but with fewer side effects. It also helps regenerate liver tissue, which is critical in people who've abused alcohol for years. Alpha-lipoic acid, ALA, is another supplement with powerful detoxification and neuroprotective effects. It helps regenerate other antioxidants in the body, like glutathione and CoQ10, and crosses the blood-brain barrier to protect neurons. Alcohol and tobacco both damage the mitochondria, the powerhouses of the cell, and ALA helps restore mitochondrial function. In the United States, ALA is used in integrative recovery protocols to help protect the brain and liver from oxidative damage during detox. People in recovery often describe a gradual return of mental clarity and physical energy with consistent ALA use. It also helps regulate blood sugar, which can reduce the sugar cravings that often replace smoking or alcohol habits. Cravings don't disappear with willpower. They vanish when the body and brain are properly fed and protected. CoQ10 is another mitochondrial powerhouse. Long-term alcohol use robs the body of CoQ10, and smoking reduces its availability by creating oxidative stress. CoQ10 supports heart health, energy production, and brain function. People trying to recover from years of substance abuse often feel extreme fatigue and muscle weakness. CoQ10 helps restore energy levels and protect against oxidative damage in the brain and heart. In American clinical settings, CoQ10 supplementation has been shown to improve mood and cognitive function in recovering addicts. It's particularly helpful for people who feel like they've aged 10 years during addiction, because in many ways, their mitochondria have. Bringing CoQ10 levels back up is like recharging a dead battery. Resveratrol, the antioxidant found in red grapes and red wine, may seem ironic in alcohol recovery, but it has powerful protective benefits. In non-alcoholic doses, resveratrol supports brain plasticity, reduces inflammation, and helps repair DNA damage caused by alcohol and tobacco. Studies from the United Kingdom and Canada have found that resveratrol can help restore hippocampal function, the part of the brain responsible for memory and emotional regulation. People often say they feel like they've lost themselves during years of drinking or smoking, and resveratrol helps bring cognitive function and emotional control back online. It also supports the cardiovascular system, which takes a massive hit from both nicotine and alcohol. Taurine is an amino acid that supports neurotransmitter balance, liver detoxification, and cardiovascular health. It has a calming effect on the brain and is especially helpful for people recovering from alcohol, as it can modulate the GABA and glutamate systems, two systems that become destabilized during withdrawal. Taurine also helps protect against alcohol-induced liver damage and reduces the risk of seizures in severe cases. In Australia and Canada, taurine is used in advanced recovery protocols for people at risk of delirium tremens or severe withdrawal symptoms. It has a dual effect, calming the brain while protecting the organs, and this makes it invaluable in recovery. Selenium, a trace mineral, is often depleted in people who smoke or drink heavily. Selenium is needed for glutathione production, thyroid health, and immune function. A deficiency can cause fatigue, depression, poor immunity, and even hair loss. In U.S. clinics, selenium supplementation has been shown to help restore vitality in recovering addicts, particularly when combined with other antioxidants like vitamin E and C. It also supports detoxification pathways in the liver, helping the body eliminate the massive toxic load created by smoking and alcohol. Without selenium, the body struggles to complete the detox process, leaving people feeling tired, inflamed, and mentally foggy even after quitting. L-theanine, derived from green tea, is a powerful anti-anxiety supplement that supports alpha brain wave production. These are the brain waves associated with relaxed alertness. L-theanine helps reduce anxiety, irritability, and restlessness, all common during smoking and alcohol withdrawal, without causing sedation. It works well with caffeine for people who are quitting alcohol but still need a bit of stimulation during the day without triggering anxiety. In programs across the United States and United Kingdom, L-theanine is used to calm the mind, reduce stress-driven cravings, and help with focus and mental clarity. Acetyl L-carnitine, ALCAR, supports mitochondrial function, mental clarity, and nerve repair. Chronic alcohol use damages the nervous system and impairs memory, focus, and reflexes. Smoking damages oxygen delivery and blood flow, especially to the brain and extremities. ALCAR helps restore mitochondrial function, supports the production of acetylcholine, a key neurotransmitter for memory, and even promotes the growth of new nerve cells. In American addiction clinics, ALCAR is often used for post-acute withdrawal syndrome, where people experience lingering brain fog, depression, and fatigue for months after quitting. People report improvements in motivation, energy, and memory within a few weeks of taking ALCAR consistently.